Good afternoon. My name is Dr. Brian Nocon. I am a general surgery resident currently in my fourth year here at University of Saskatchewan. Our project is entitled AI-derived information on indeterminate long nodule. How do patients want information presented to engage in shared decision making? Lung cancer diagnosis can be a very devastating news for a patient to receive. In the latest report released by Statistics Canada, lung cancer is the most diagnosed cancer in Canada as well as in Saskatchewan. It is also the most common cause of cancer death both nationally and in Saskatchewan. Of those diagnosed, 5-year survival rate is at 17%. Lung nodules are associated with cancer, usually found as incidental findings on imaging for other reason. With smaller lung nodules, radiologists may find it challenging to see whether it is malignant nature or benign. These nodules are then called indeterminate lung nodules, as it is uncertain whether they are benign or malignant in nature. Because of their indeterminate nature, patients are advised to undergo further imaging, some of them within 3 to 6 months, to determine its clinical significance. Surveillance imaging may last up to 2 years. Now, further imaging required may be of CT scan or use of a PET scan. Some patients may require a more invasive procedure to investigate whether the nodule is of benign nature or malignant. A biopsy of the lung nodule using a needle either by guidance of CT scan or endobronchial ultrasound, which uses fiber optic camera and ultrasound to guide the needle. These procedures may cause complications such as pneumothorax or hemothorax. For a lot of patients with indeterminate lung nodule, the thought of having an indeterminate lung nodule causes anxiety and stress, living for months not knowing whether they have cancer or not. The thought of not knowing exactly what they have and feeling of helplessness, as they could not do anything other than wait for their next imaging study. With advancement of technology, this gives us an increased computational capability. We are able to harness technology to help us become more accurate with our tasks and analyze data more efficiently and more accurately. An emerging technology is radiomic analysis, which is a type of artificial intelligence looking at radiographic images in radiology. AI is a tool that can help us in many different aspects of our lives. It can help grow different industries and also help us become more efficient with our tasks. As illustrated in this image, artificial intelligence can be designed and applied to different fields and industries. AI can also be used in healthcare. For those of you who, like myself, like to watch animation, AI in healthcare is famously portrayed by Baymax in Big Hero 6. AI in healthcare can be used to analyze large amount of data and help us understand what may be difficult to comprehend due to the amount of information that needs to be taken and accounted for. How then should we have AI deliver the information we need for us to understand it? Will we need a C3PO to understand what R2D2 is telling us? Or designing AI like Jarvis, who is able to convey the information to us or our patients in such a way that we understand it and it makes sense? With difficult news of having an indeterminate lung nodule that may possibly be cancer, patients are faced with difficult decisions: to watch and wait, to have surveillance and further imaging, or to have a biopsy done with associated risks. With the help of AI, a more accurate look at indeterminate lung nodules may help both patients and care providers with deciding the right path for the patient. How then do we convey AI-derived information to patients that is easy to understand to engage them in shared decision making? Wouldn't it be easier to have a conversation about choices if options are laid out and information is conveyed in a manner that patients prefer? With the help of patient's care provider and information derived from AI, presented and conveyed in a manner that patients understand and appreciate, options may be presented better, which in turn engages patients in a shared decision-making process, taking into account patients' personal beliefs, values, and preferences. What really matters for patients matter. And so we ask, how comfortable are patients with use of artificial intelligence? How do patients want AI-derived information presented and conveyed to them? And how do beliefs, personal values, and preferences influence the patient's decision? These are our questions. Our team is composed of patient family advisors, academic researchers, clinical researchers, and like myself, resident researchers. In collaboration with our PFAs, we have conceptualized this patient-oriented project. Together with our PFAs, we will be implementing this project and later on work together in presenting and publishing our findings. We are looking for our patients diagnosed with indeterminate lung nodule, considered to be primary of nature, between the months of January 2020 to April 2020. The design will be of a qualitative study design, and sampling will be of convenience sampling between these months. One-on-one interviews will be conducted using an interview guide. Interview guides will be co-developed with our PFAs. Interviews will be done by either a resident researcher or one of our PFAs. Interviews will be recorded and later on transcribed and coded. Content analysis will be done to find themes and associations. At the end of our project, we hope to assess comfort of patients with use of AI, identify how patients would like AI-derived information be presented and conveyed to facilitate shared decision-making, and identify personal beliefs, values, and preferences that influence patients' decision. Together at PFAs, we plan to co-present our findings in national conferences and submit our findings for publication in clinical journals. Also, with their help, we would also plan to present our findings with advocacy groups as well as patient groups. And at the end of the day, with proper, informed, and responsible development of technology, we believe that AI can help us in improving diagnosis and foster patient-centered care. I thank you for taking time to listen to my presentation, and I hope that you have enjoyed it.